Let's talk about keeping it ethical. I'm going to run through a framework for clinicians to disseminate your expertise through either a course or even coaching, just to have that greater reach and impact without crossing boundaries. So creating courses, if I say something a million times this CEU, it's not treatment. This is not therapy. It's professional communication, right? Ethics applies to course creation when we're representing our credentials, teaching behavior analytic concepts, marketing educational offerings, and influencing how others may apply strategies. And so ethics still matters, even though it's not therapy. And I'm going to show you how you kind of think through some of the questions you've included in the chat. How do I know if I'm competent? How do I really represent myself? How do I avoid harm if people need more than what I'm able to offer? So in terms of competence, the goal here is we're teaching topics that you have direct training, experience, or supervision in. Be clear if content reflects general education and not individualized treatment. We'll talk about how to represent yourself shortly, but basically you don't want to confuse people. You don't want to say, hey, I'm teaching all of these behavior analytic skills, but it's a course, not treatment, right? And so making sure that you're solving a very specific problem and you're avoiding presenting yourself as an expert in areas that are outside of your training. For representation here, we want to avoid exaggeration, right? Whatever outcome we're describing, we don't want it to replicate treatment. We don't want to confuse people and have them assume that they're going to achieve the same outcomes of treatment. And your audience may not even be clients or parents or families. It could be other BCBAs. So the goal here is just to clearly explain who that course is for and who it's not for, right? So if you do need extra support, guidance, feedback, then maybe you take a different route. And then finally, use your credentials and titles accurately. You can include like a statement such as results will vary based on context, consistency, and individual factors. When that person goes to buy that course, they now know I'm not going to get all of this contextual, individualized, barrier-specific support. I'm going to get some educational foundation, and then from there I can seek additional support and guidance if I need it. In order to avoid harm, I want to emphasize that we're not giving prescriptive treatment recommendations within a course. And so even though you may repeat that often throughout your clinical experience, that is one area we want to avoid when we're creating a course. I encourage consultation if complex issues arise. So if someone is going through a course of mine and I know that a common objection or barrier might be X, then I might articulate that. Hey, if you experience X, make sure you talk to somebody that's qualified to address that issue. You want to include decision points, right, throughout your course that say, hey, if safety concerns are present, if you're experiencing X, Y, or Z, then seek professional guidance. It doesn't necessarily mean you have to address that concern, but you are avoiding harm by making sure they know where to go to seek support. For transparency's sake, we want to make sure we clarify the scope, objectives, and format of the course. That way, again, people understand, say this is self-paced. It doesn't include individualized consultation or clinical assessment, right? State what is included and what is not included in the course, and clarify whether you're going to have any live support, feedback, or consultation as part of it. As much as you can communicate in advance and the more transparent you can be about what you are trying to achieve within the course, the better aligned people's expectations will be, the less concerns and issues you'll have. And then evidence-based, right? Distinguish clearly when something is research supported, emerging practice, or just your professional opinion. And you do have a professional opinion that you can share, right? Your experiences matter. And so whatever you have gone through, how do you teach those concepts in a way that clearly specifies when something is grounded in the research and when something is perhaps a story, a scenario, or an experience that you've had yourself. The specific kind of verbiage recommended for a course, for example, is this course provides educational strategies and frameworks, not clinical treatment recommendations, especially if your audience is going to be parents, families, clients that may be accessing your educational content. So just kind of a quick overview here to sort of summarize what we've talked through. Education is going to teach these frameworks, right? These repeatable processes that you've done time and time again with your unique approach blended in. You're also going to support skills and understanding, and you can apply that teaching more broadly than just treatment, right? Maybe any parent benefits from this education versus a treatment that is individualized for that client. And it doesn't involve any treatment plans or care factors at all. In treatment, we're of course assessing, programming, making database decisions on an ongoing basis, and we have that professional accountability, and it's very, very different. So your course belongs on the education side. It should empower people, but it's not a clinical service. Okay, so in the chat, I kind of want you to walk through this with me. And as you're thinking through your course topic, throw in some of the ideas that you have. I'd love to see the different ones because people always have something new to share here. But for course topic, this doesn't need to be a new idea, a new degree, a new experience. It can be something that you already do repeatedly. In fact, that is often a sign that you're in that safe zone. And so thinking about these questions, throw in the chat what comes to mind first. So what problem do you explain over and over, whether that's to your team, to families, to other providers, right? What is the problem that you are explaining over and over again? What skill do people constantly ask you for help with? Where do you feel unusually clear and confident? Like you are like, I could do this in my sleep. What topic do I find myself mentoring others about? The thing that I kind of keep coming back to, whether they're asking me or not, I'm volunteering information about this thing because I love it and I'm passionate about it. And then what do clients, caregivers, other BCBAs, RBTs, team members say that I explain well? And they may not say it in those exact words, right? But what is that thing that you are constantly repeating that is kind of underlying a lot of your conversations, your advice, your support? Elisa, teaching emotional regulation. Very cool. Robin said parent training and support within the home environment. Awesome. Galina, I hope I'm saying that right. Maybe it's not. Behavior maintaining variables. Yeah. Positive behavior supports in general. Content creation. Yeah. That's cool, Megan. Awesome. NET. Perfect. Play skills and video modeling. BST. Yeah, so these topics are standing out, right? You're thinking, okay, I'm good at teaching this. I know that when I teach it my way with my specific framework, style, and approach, people actually get it and they start using it. And that's the goal. That's the impact that you can have. And you're already having it within your sphere. Now your course helps you expand that outside of just your bubble. Proactive strategies, Amanda. I love that. Establishing and maintaining instructional control. Fantastic. Clinical quality and setting organizational goals. That's very cool, Lauren. Effective communication and building rapport. Perfect. Yeah, and you're already building it. Perfect. Okay, so great. We're kind of topic forward here. So you've got an idea in mind. Here are some other things to consider, right? These are not new fields. They're just refining your focus area. So rather than saying, I teach ABA or I have this course on behavior supports, I'm adding some context, some topical detail, right, to that course. So behavior in classrooms, parent collaboration and routines, functional communication skills, emotional self-regulation, transition planning and independence. Any of these ideas, right, are problems that we solve on a day-to-day basis that we can teach more broadly than just within our caseload.